When it comes to taking care of your heart, there are things you can do to make sure your risk for heart disease are kept low. And this morning, Dr. Shoba joins us to discuss risk modification for heart health. Good morning, Dr. Shoba.
Good morning.
Let's talk about that. What can we do? What behaviors can we modify to make sure that we have the best heart health we can have?
Right, and in these times of these pandemics, when the stress levels are so high, I think people are paying lesser and lesser attention to the health, not just mental health, but also physical health as well. So, health is emotional, mental, physical, and I think, we are letting ourselves go on all these counts. And I would encourage everybody to look to see what exactly they did yesterday for their health. I try to think about, a good topic for today, and I realized that I myself, even though I'm a physician and a cardiologist, had not done enough yesterday for my own health. And so I thought we'll go over the risk factors for heart disease, because your heart and your body parts all share the same risk factors for disease progression.
Well, let's talk about those risk factors. Kind of give us a list there of those factors that we can do some things about.
Right. There are some unmodifiable risk factors. Your age and your genetics. Right now, they are not modifiable.
Right.
But some things are definitely modifiable. I thought about the things I ate yesterday, and they were not good. I had eaten stuff with a lot of salt in it. I had eaten stuff with a lot of cheese in it. And unfortunately, I found some cookies in my home, and I'm not a cookie eater. But I ate a couple of cookies last night before I went to bed. There goes my heart health down the tubes. Did I put myself at risk for getting diabetes, for getting high blood pressure in the simple things that I did yesterday? Unfortunately, yes. Did I exercise yesterday? Unfortunately not. And in these days with pandemic times, people are not going out as much, which is good. But unfortunately, I don't think they're picking up the exercise at home. Previously we went out to the stores, we walked outside, and I think all that has gone downhill. And you were talking about homeschooling, parenting, and that adds the added stress, and that takes away more time from the population to take care of their own health.
And I was going to ask you too, when it relates to COVID-19, I think a lot of folks may need to go in and see a physician, see their doctor about something heart-related, and they're afraid to because of the coronavirus and the COVID-19. Are you finding that to be true as well?
Unfortunately, yes. People are waiting a little longer to get tested. They do not want to come to the doctor's office. Some of them do not have blood pressure checking equipment at home, and they're not checking their blood pressures. Even simple things like weight gain, blood pressure checks. If you're having symptoms, fatigue, shortness of breath, getting more tired easily, it is taking you longer to do the same activities as before, you may already be having heart disease or disease progression. Diabetes, for example, is so prevalent in this area. Did you get checked for your blood sugars for diabetes? Are you eating healthy? Some of these things are so important. People with diabetes are at higher risk for having heart disease. They are at higher risk for having heart attacks. Diabetics can have silent heart attacks. Their blood is a little thicker. Their arteries in the heart can be a little narrower, more diffusely diseased. You are at higher risk for having heart disease. And if you're not paying attention to your symptoms and not going in to get your regular checkups, you have done yourself a disfavor.
And there, we're talking about health behavior modifications. I think a big one for a lot of folks too is stress right now. Because of the pandemic, stress, and maybe some folks smoking. Stopping smoking during this time is especially difficult, but you need to do it.
Right. You hit the nail on the head with smoking and binge eating and stress causing people to binge eat, smoke more, not exercise, get more depressed. But it's a vicious cycle. And these factors don't affect just your heart. They affect your brain. They affect your circulation in the legs. They affect the way how you approach life in general.
Stress is just such a killer, and it is so difficult these days to get away from stressful situations. It seems like, you turn on the TV, you watch, you see what's going on in the world. Stress is just a part of everyday life, and it's how you deal with it that's important, isn't it?
That's true. You need to look for something positive and think about that and not just focus on all the negative at all times. And that is the key. And every day, I want you to think about what is the one good thing you're going to do for your heart. One good thing you're going to do for your family. In fact, if you take care of yourself, you're doing a lot of good even for your own family. So see if you exercise, see if you got enough sleep, see if you learn to deal with stress a little bit better. Make sure you didn't binge eat, you didn't smoke, you didn't grab that extra cookie, you did not grab that extra ice cream that was not necessary for you. Don't stock your pantry with foods that are bad for you, because you are more apt to grab them when you're under stress. So, caffeine, the sodas, try not to stock your home with things that are bad for you. That way you will not eat those things when you're stressed out. Please go through your checklist. Did you exercise today? Did you control your emotions today? Did you eat right today? Those are the simple things that you can take to take care of your health. And of course, like you said before, talk to your healthcare provider.
All right. Very good. Dr. Shoba, thank you so much. Great advice. Great words of wisdom that we all need to take to heart.
Thank you.
All right. Folks, if you got questions, there's a number right there and a website right there at the bottom of the screen. It is time to modify our behaviors a little bit to take care of our heart health.